Hi everyone, I'm Sarah from SkillBase First Aid, and today I'm going to talk to you about heart attacks. Now, I'm stood outside in the freezing cold because heart attacks are more prevalent in the winter than they are in the summer. Your blood gets a bit thicker and so heart attacks become more common. Now, everybody asks us, what does a heart attack look like? Everybody's used to seeing what we call the Hollywood heart attack on TV, which is when your casualty all of a sudden grabs hold of their chest, starts to feel really poorly, and drops away to the floor. Now, unfortunately, heart attack doesn't always look like this. It can present very differently between men and women, and the symptoms can vary drastically between casualties. It's really important then that you guys know what it is that you're looking for. So here it is. Some of the symptoms that might present themselves include a crushing or tight or squeezing pain in the centre of the casualty's chest, although some heart attacks can be completely painless. The casualty's pain may spread, it may radiate over into usually the left arm, sometimes up into the back of the shoulder blades, the top of the abdomen, the jaw, the neckline. There's loads of places in which this pain might kind of spread itself out away from that centre of the heart there. The casualty may be feeling or being sick. They usually look a bit paler than normal, with possible grey or blue colours around the casualty's lips, and the casualty will be feeling dizzier and weaker than they would do normally as well. So the big question then, if you think your casualty is having a heart attack, what are we going to do about it? Well, the first thing you're going to do is you're going to make sure you call somebody. You're going to call 999 for an ambulance and tell them the casualty is experiencing a heart attack. We're going to put the casualty in what's called the W position, like this. So you're going to lean your casualties back up against something, keeping their knees elevated, and this helps to ease the blood circulation around the body and make it easier for the heart to pump the blood around there. If the casualty has their own medication, you're going to allow them to use their own medication. This may help to subside the symptoms for a little while as well. If they haven't got their own medication, you can offer them a normal dose of aspirin. So just read the back of the packet and see what a normal dose is. Sometimes it's 2 tablets. If your casualty is taking aspirin, you're going to want them to chew the aspirin up in their mouth if it's non-dissolvable, or it can be dissolved in the mouth, but the casualty mustn't swallow it with water. It doesn't work as quickly if they don't swallow it, so we need to chew it up in the mouth so it dissolves straight from the mouth and into the blood supply. Key point, make sure your casualty stays nice and calm. The calmer that your casualty is, the more relaxed their heart rate will be, the easier that the pain will feel, the better that they will feel as well. Final thing to remember, if your casualty situation changes or worsens, you're going to use your emergency plan. So back to doctors A and B. Really helpful as well if there is a defib present, to fetch your defib just in case the situation gets gravely bad. Hope none of you are having heart attacks anytime soon. See you later.